Good afternoon. My name is Michael Whitney, and my interdisciplinary teaching activity is teaching extubation criteria and weaning criteria on the vent to new RTs from an education coordinator. This is important for new RTs to understand to extubation criteria, so you know when you're going to start a spontaneous breathing trial, when you're going to ask a nurse to start a spontaneous awakening trial. So it's all for the benefit of the patient. Without the proper criteria in place to start a spontaneous breathing trial, then we might start flipping people to pressure support CPAP or weaning modes that aren't quite ready. So we have an exclusion criteria set out for these patients that will allow the RTs to follow this specific criteria to know when or when not to start the SBT. And then after they get the criteria in, and then they know what to start the patients on, so we can get them extubated with the pressure support of a baseline of 8 and a PEEP of 5 and at least 40% or less on the vent. So this is a teaching criteria for all new grads, all new RTs that come through, so everybody's on the same page, and so that when we talk to the physicians, it's all about communication. So when we communicate to the physicians, we can go in and say, hey, this patient met the criteria, they passed their SAT, they passed their SBT, they're awake following commands, they're able to, there's a cuff leak that's positive, we flipped them, we got an RSBI on a pressure support of 0 and is less than 100. Well, we got a blood gas after 30 minutes and the patient looks like they're ready to extubate. So it's all about the benefit of the patient, as well as the communication with the physicians, so we can do what's best for the patients while communicating with the physicians, so everybody's on the same page for the betterment of patient outcomes. And then every year we can use the same teaching opportunity during competencies, so we can make sure that the RTs stay on the same page with the communication about SBTs and SATs every single year, and they're talking to the physicians and trying to get these patients extubated as soon as possible, because we all know as soon as you intubate somebody, the most important thing that we're trying to do after we intubate them is get them extubated. So the exclusion criteria for new RTs is very important to try to help patients get extubated on time, communicating that with the physicians, and it's better for patient outcomes in the long run. Thank you.